So across Africa, official development assistance is declining, and therefore there's an urgent need to rethink how the continent will finance and sustain its health. Now, the context underscores a very fundamental truth that we must begin to figure it out with the right local and international partners by prioritizing various healthcare needs vis-a-vis the financial resources available.
It's a big deal to look at health from an economic perspective. And health from an economic perspective is not necessarily how to finance health, it's about what health means in the overall transformative agenda for the country. So if we appreciate why health is being used to drive economic transformation, then we can now talk about the leadership.
We are fortunate that this country is known as a Silicon Savannah for good reason. We are very, very good at building ICT systems and digitization. Through those tools, we can improve accountability, even at personal level, as a doctor, as a nurse, as a healthcare facility, and we therefore must fully deploy ICT across the entire sector. As far as I'm concerned, it's a glue and the catalyst for the sector.
How we are utilizing the already limited resources that we already have is absolutely critical. So it's efficiencies, for example, in also how we are allocating resources to primary healthcare, and I'm very happy that the Social Health Authority, one of the funds that we have there is on primary healthcare. But we also need to talk about efficiencies across other systems, supply chains, IT systems, around human resources for health.
The rethinking what we mean when we say self-sufficient, I think is more partnership more than anything else. It's partnership with governments, with other governments. It's partnerships with donor organizations. And that these partnerships should take cognizance of the fact that doing an abrupt stop of funding creates chaos.
We must ask ourselves, where does the greatest benefit lie in optimizing our healthcare system? Where does the greatest benefit lie? And I think a couple of areas. One, primary healthcare. I think it begins and ends at community level. The second thing is we must figure out where our efficiencies are. The current stab at THC is buttressed on 4 pillars: digitization, healthcare financing, primary healthcare, and commodity security.
And one of the things that we've unfortunately not done very well is actually inculcating effective governance structures in our design, in our implementation and all that. And they usually summarize that into 4. 1, do we have fit-for-purpose institutions that can deliver on our healthcare needs in this country? 2, do we have an accountability matrix that can be able to actually get deeper and tell us where the gaps are? 3, how are we translating global policies into local practice? And then 4, what kind of transformative partnerships are we having as we deliver our healthcare services?
The African nations, including mine, must have a realistic view into their healthcare financing architecture. There is no ecosystem that will be sustainable if we don't invest in prevention and promotive.
There's a role for the public sector, there's a role for the private sector, there's also a role for the philanthropies. For example, public sector, one of their main role is regulation. The private sector can lead in innovation and specific service delivery contracts or service delivery bits and pieces. The philanthropists can bring in money for innovation and scaling some of the things that work.
So the shift that we need to see is if philanthropy, including Global Fund, becomes a catalytic capital that co-invests with government, not replacing it.
In terms of the communities are not beneficiaries, but they should be the architects and finally the auditors of what a health system should look like, so that any change that is coming in terms of the priorities actually has the community at heart. So some level of stable country plan enables us to form long-term partnerships. And even now Kenya, speaking of Kenya with 48 different governments, we need also government to take up the role of stewardship and governance very, very seriously.
At our level, we have established a health policy platform. And we are looking at the health side, that is the epidemiological issues on the health side. But then there is also the economic issues. And we want to marry the two. But how to marry the two is to create an opportunity for people to participate and to create a criteria and a structure that then enables us to see how money enters the healthcare system, what it does, and the outcomes.